Hello, everyone. I'm Becky McGregor, your APS Employee Wellness Coordinator, and with us today is 𝐰𝐰𝐰 Perea, and she is with Presbyterian Health Plan. She's going to talk to you all about your Presbyterian Health Plan benefits. I want to just remind everyone that open switch enrollment is October 1st through the 16th, 2025. For benefits that start January 1, 2026. We do have our Employee Wellness Fair, October 7th and 8th, 2:30 to 6 p.m. at Bonifacio. And Presbyterian Health Plan will be out there to answer any of your questions about your benefits. With that, I'm going to toss it on over to 𝐰𝐰𝐰 and let her take it away.
Thank you, Becky. Good afternoon, everyone, or happy Balloon Fiesta weekend. It's starting all over and it's wonderful. But welcome to the Albuquerque Public Schools open enrollment fair and meetings for 2026. We want to give you some information basically for your benefit plan for 2026, give you some plan updates and give you some no cost access care options, and then give you a little bit more information about what's offered to you with your Presbyterian plan. So what is your out-of-pocket responsibility for your plan? So you have an EPO plan, which I'll go in a little more detail in just a moment, but basically you have a deductible for certain services. You have an out-of-pocket maximum, which is your safety net as a member. You know that you'll only have to meet that much out-of-pocket for that calendar year before the plan pays 100%. Preventive care is always covered at 100%, so please go and get your mammograms, colonoscopies, and things of that nature. Anything that's ordered at that time, including any lab work, is paid at 100%, so please take advantage of that. And then you do have co-payments for primary care doctors, specialist visits, and telehealth visits. So you do have some coinsurance and deductible for the other benefits. So please take a look at your benefit guide and it'll give you all of the details for those benefits. So what type of plan does APS offer for their employees? You do have an EPO option, and I will talk about your provider network and what that means to you. So an EPO is pretty much like it works similar to an HMO plan, but you do have no referrals for your specialists, elective services outside for your network providers. You do not need a referral. Out-of-state coverage, you have urgent and emergency care outside of New Mexico and outside of the country. And you do have access to UNM Medical Group and UNM Hospital. Along with that, you are also able to utilize in-network the Optum providers. So peace of mind, we want you to know that when you have dependents that live outside of the state of New Mexico, they do have access to a national network. So what that means is they can utilize the Aetna network. Anybody on the plan that is your dependent living outside of New Mexico that is between the ages of 17 and 26 can utilize the network for primary care, specialist care, and any hospitals that are contracted with the Aetna network, and they will have their benefits paid at the in-network level of benefits. So I do have the information here where you can log in to take a look at that, the providers, but I will also have that at the open enrollment meetings, which are next week. So please stop by the table and we'll give you all of the information. How to access lower out-of-pocket costs. We always want to make sure that you know how to utilize the benefits to the best benefit as far as what comes out of your pocket. So when you utilize the facilities that are not part of a hospital setting, so for example, Tricor Labs or New Mexico Orthopedics Radiology Associates, you will pay the lower out-of-pocket cost based on the information in your benefit booklet that again, you do have available to you on the APS website, on the vanity page with Presbyterian, and I will also have it for you during your open enrollment meetings. 24-hour, 7-day-a-week care we do have available for Press Now facilities. Those are for urgent and emergency care services. Again, 24 hours, 7 days a week. We do have pediatric care available as well. Those providers are the only providers in the state available 24/7 for pediatric care. Great place to utilize your care at a lower out-of-pocket cost, more convenient, and they can detour you wherever you go if you need emergency care or urgent care at that same facility. So options to no out-of-pocket cost. We do have our nurse advice line, which is available to you 24 hours a day, 7 days a week. Those nurses can triage you, can help you decide whether you need to make an appointment for next day, or if you need to go to the hospital. They have access to your records if you see primary care doctors within the Presbyterian medical groups, or if you've been treated at the hospitals, Presbyterian hospitals. They can see what you've been treated for and what you've been prescribed. So in case you have questions regarding your medications, they can help you maybe figure out if you're having an allergic reaction due to those medications, or they can also message your doctor to let them know that you called in and that maybe they need to reach out to you for further evaluation. So you do also have available to you 24 hours a day, 7 days a week video visits. Those are zero out of pocket to you as an APS employee. My chart, great way to message your doctor and get refills, or just let them know how you're feeling, and they can respond to you within 24 hours to see whether they think that you should be seen, or they can just submit a prescription for you wherever you go to pick up your prescriptions. So a great tool to use for convenience of care is our virtual care. We have access to, the reason for this is we want to make sure that we want to reduce the barriers. So if you don't have time to go to the providers, you want to see someone while you're at work, or whether you're at home, we want to make sure that you have the care that you need virtually. So that access is available to you for primary care visits, urgent care, behavioral health, dermatology visits, and any providers that have access to virtual care. So for example, I see providers for my endocrinologist. He is also available virtually. So it's not limited to those providers, but those are specific providers that we have specialized to get them available for virtual visits. So this is the information for urgent care and what they can treat you for. Great tool to use so that you don't have to make that trip to the urgent care facility if you're not feeling well or your child is not feeling well. This is your video visit information. So this is the video visit care if you're outside of New Mexico, or if it's in the middle of the night and those providers with the Presbyterian medical groups are not open yet. So you can use this tool to be seen for urgent services 24 hours a day, 7 days a week, zero out of pocket for you. These are also tools that are available to you at no out of pocket. So you have Talkspace available for you to see licensed credentialed therapists 24 hours a day, 7 days a week. That's zero out of pocket. You can either text them, you can see them virtually, or telephonic. And then you also have tools through BetterHealth. Those are tools for behavioral health services. They do connect you with case managers that can help you when you have a high risk need for someone that you need to speak to urgently. How do I find this information? How do I make appointments for all of these visits and these services? So you can go to the phsgetcare.org website. That will lead you to this screen here. You can choose what kind of visit you would like. It'll give you, for your plan, what your out-of-pocket would be for those services. You can also schedule those services via this tool. For those times when you want to speak to somebody over the phone and you want to get billing questions answered, benefit transition questions answered, or just any questions that you might have regarding your services that you've had or that you would like to have. We do have a dedicated unit for APS members. Please feel free to call them. They're open 5 days a week, and or you can email them and they can respond to you that way. Let's talk about what you have available to you as far as advocacy care. We have care coordination, disease management. We do have community health care workers available to you, and some wellness benefits. So we want to make sure that your care is well-rounded and you have the correct care for whatever's going on at the time in your life. So we have disease management available to help you with chronic conditions. You do have a disease manager that can be part of your care to help you manage your diseases based on what's going on. So for example, diabetes, asthma, COPD, those folks will be available to you to help you with prescription questions, how you can manage your disease state. So that is a great tool to use. You can email them and call them to set up your evaluations. And then you also have care coordination. Care coordination is a tool that you can use if you are, for example, managing cancer care and you need to coordinate your visits for hospital care, specialty care, you have questions regarding your prescription benefits. They can help you coordinate all your care with all of the providers within your team. Again, you have a care coordinator assigned to you, so you can self-refer or you can have a referral from your physician. Community health workers are there to help your community, whether it's you're an APS member or not. They help you with certain food insecurities, or maybe you have behavioral health issues that you need help with that you don't know who to reach out to. And they also can help those folks that are homeless or need some help with some your utility bills. They have the resources available for you that can help you with those programs. Your wellness tool. Great program that APS offers for you through Presbyterian. It's a wellness at work platform, and you are able to earn up to $150 in rewards based on the activities that you engage in within the program. And the way you can find what those programs that are available is to go to the MyPress tool, and you go to the wellness platform, and you can get all of the information that you need on that email address, or I'm sorry, the website. So these are the programs that are available to you. You have cooking classes that are virtual, great cooking classes, nutritional classes. You do have a Life on Mindfulness platform. So if you're more the type that likes to do yoga or those types of exercises, they do have meditation programs or classes that you can be a part of during the month. So please feel free to take advantage of all those classes that are available to you. And then you do also have healthy coaching available. So you have a nutritionist that can work for you to help you maybe with your day-to-day nutrition cooking. And this is a one-on-one program that could help with your diabetes state. So anything that you're just trying to eat healthier, they are there available to you through this wellness program. The Fitness Pass, great program that's available to you. I do want to mention that that is changing. The cost of that is changing per employee or per member, per eligible member per month. Effective January 1st of 2026, the out-of-pocket cost will be $29.50 per month. You no longer have to re-enroll if you wish to continue with you're currently enrolled and you wish to continue with that program for the remaining part of the year and going forward. Don't have to re-enroll, which is a great thing. If you wish to cancel your benefit, you will need to contact the customer service department no later than December 24th, and they will disenroll you for the January New Year. You do have access to Define Fitness, all of the Prime Fitness gyms all over the country, and Sports and Wellness at a discounted rate. You don't have to choose one single gym. You can go to Defined in the morning and then maybe go to Choose or Planet Fitness during the afternoon. So you have all of the gyms available to you at the cost of $29.50 per eligible employee per month. How to enroll. You can go to the phs.org/wellness site. They will ask you for anybody that's eligible for the program will show up on the screen. You can choose if you just want to enroll yourself and spouse, or yourself and your dependents over 18. Once you are enrolled, it will ask you for all of your payment information, and it'll give you your confirmation that'll be sent to your email. You will be eligible for the gym membership first of the following month that you enroll in. Again, you do not have to re-enroll, and you do have access to all of the gyms available to you through the Fitness Pass. That was a lot of information in a short amount of time. So we want to make sure that you know that you can go to the phs.org website, you can go to the APS website, or you can join us for the open enrollment fair next week, and we will be there to answer any questions that you might have. Thank you so much for your time.
Thank you so much, Ida Marie. Thank you, everyone. This was a presentation from Presbyterian Health Plan. We do have these on, we have the slide decks. We have this video, obviously, on our YouTube channel. But I really encourage you to join us at the APS Employee Wellness Fair. It's a great opportunity for you to have dialogue right there with Ida Marie and other representatives from Presbyterian Health Plan, so you can get your questions answered and really understand the full benefit of Presbyterian Health Plan. They do offer quite a bit of resources for our employees, and we really want you to take advantage of that. So again, open switch enrollment is the 1st through the 16th, 2025 for benefits starting 2026. This video presentation also serves our new employees who are coming on board in the year of 2026. So you might be watching this after open switch enrollment in 2026, and that's fine. But we always encourage you to reach out to us with any questions, and those emails are in the description below. Thank you again, Ida Marie, for your time.
Thank you.
All right.